Welcome back to Sleep Better TV. I'm Tasia Custodi. I'm joined once again by Dr. Blake Perkins of Dental Sleep Medicine in Vancouver, Washington. Dr. Perkins, I want to discuss with you something kind of a little confusing, for me at least, and that's dental insurance. So let's start with the history of it. Where did dental insurance come from?
Oh, dental insurance has not been around all that long, actually, in comparison to medical insurance. If you look back to about the 1960s is when it started. And the average policy back then paid out about $1,000. And it was a pretty simple plan. If you fast forward to today, unfortunately, the maximum is the same, $1,000 or $1,500 depending on your policy. Not much has changed. What's changed is now there are more exclusions, more fee schedules, more complexity to the dental plan than there ever was back when it started.
Okay, so why is dental insurance so different from our medical insurance?
Well, you know, every day I have multiple conversations about dental insurance, and I have to tell you, they're never good conversations. With medical insurance, we all kind of understand how our insurance works. We have a deductible we're supposed to meet, and then once we've met the deductible, our insurance is going to pay any percentage of what our costs will be. And most people accept that and just move forward, and they're glad they have medical insurance. We also have to remember that medical premiums, what we pay for that insurance, is quite a bit higher than dental insurance. In comparison, dental insurance is less expensive and it covers less, and most people don't really see it as a value to spend much more, mainly because the cost of dentistry isn't as high as the cost of medicine.
All right, break it down for me. How can we figure all this stuff out?
Well, basically the best thing you can do to understand your dental insurance is to realize that it is not there to pay for all of your dental care. And that's the biggest mistake that most people make. I hear a lot of times, well, I don't want to do that if my insurance doesn't cover it. Well, if you go to the hospital and you have a broken arm, are you going to tell the doctor, well, if my insurance doesn't cover this, forget about it, I'm walking out the door? We don't do that, because we realize the importance of the health of our body. For some reason, there's a disconnect between the body and the teeth. And I go back kind of to the history of dentistry and medicine and look at what happened back when dentistry first became kind of a recognized field. And dentistry and medicine kind of split apart from each other, which in my opinion never should have happened, because the last time I checked, the teeth are a part of the body. And the only difference between what physicians do and what dentists do is we deal with a very specific part of the body and what to do to repair it instead of just a whole body approach. What's happening now, thank goodness, in medicine as a whole is that's kind of coming back around, and physicians and dentists are starting to realize, especially with the recognition that the dental health affects the overall health of the body, that there is a benefit to approaching the health of the mouth from a holistic way, integrating medicine and dentistry together. And hopefully someday we'll be able to get rid of dental plans altogether and have it just be one plan, and we can focus on the health of the body, including the teeth.
Thank you so much for your time today.
You're welcome.
My guest today has been Dr. Blake Perkins of Vancouver, Washington, and you've been watching Sleep Better TV.